Hello class, my name is Mackenzie and my community project is focused on healthcare disparities, but more so the racial, ethnic, and economic status disparities that certain people face. Healthcare disparities first is referred to differences in access to or availability of facilities and services. Health status disparities refer to the variation in rates of disease occurrences and disabilities between socioeconomic and geographically defined population groups. I chose this topic because I myself want to go into the healthcare field and even nursing or somewhere along those lines. And I love to help others, and I think it's so important that we help others if we are capable to and able to. I just think it's important that each individual person receives the highest and best level of care they can get, and it shouldn't be based on their background or economic status. Simple as that. So going into a few key points I found. There was this study and it was looking at Hispanic and African American people in the US, and that these individuals are less likely to be insured compared to those of whites. This causes a huge gap between patients and healthcare providers. If an individual doesn't have insurance, they're less likely to go get help or even ask a family member or a neighbor for help, for reasons being they might feel embarrassed, uncomfortable, or the fear of, being charged for services that they don't have the money for. Another study that was conducted found that results in certain areas within the US of lower income areas, high minority groups, higher crime risk areas, that they found that these certain areas had a lower concentration of pharmaceutical interventions and places where people could go to actually seek more help. And I think that is a huge problem, and it's really showcasing economic disparities at its best, and shows just how important that these people are to higher up people that are in charge of this stuff, and that's not okay. Another important study that was conducted was, that I think is really important, was whether patient to physician interaction, like contact, contributed to quality of healthcare received. The study found that different interactions, whether it be a simple hello or a full-on conversation, like you actually get to know the person and you become familiar with each other, played a huge role on the outcome of a person's health. This found that health services was lower in Hispanic and Asian cultures compared to those of white and African Americans. And that should not be the case, and is a big reason why I chose to do my community project on this. I think this project really opened my eyes. More so, I thought this situation, compared to when we first started this assignment, when we first started, I knew this was a problem, but not as big as I thought it was, and didn't think it was as prevalent in our communities as much as it is. I now know and realize that this is a much bigger problem that should be addressed completely throughout every single state and county and everything. And this is why my solution is that there should be classes and seminars for nursing students, healthcare students, people who are already in the healthcare field, and should take a seminar regarding on how making this problem more aware and knowing how to properly address it, and how to connect with these people and show that they do deserve the care that other people receive, and that they do receive that higher quality of care. And I just think that's so important. So that's kind of just the quick outline and overview. I hope you guys enjoyed it. Thank you guys so much for watching, and if you have any questions, be sure to ask, and I hope you got a little more insight to this problem.